Malnutrition, classic malnutrition. Basically, there were two types of classic malnutrition. First was caloric malnutrition, marasmus, okay, which is a Greek word that means wasting, all right? And basically, they're just not getting enough of anything. And you have muscle loss, no subcutaneous fat. They look malnourished. These are the kids you see on those late night, programs asking for money. Then there's protein malnutrition, kwashiorkor, which is basically protein malnutrition. And because it's protein, they don't have enough protein to make proteins. And so they don't have good oncotic pressure in their bloodstream because they're not making proteins. And so they'll have this painless edema. And so even though these kids are malnourished, they'll have edema. And so they don't look as bad, but they're just as malnourished. And kwashiorkor is a Ghanaian word that means basically what happens when the new baby is born. So they're breastfed, and then the new baby's born, then they put them on a very carbohydrate-rich diet, which they can afford. The truth, of course, is that it's blended. Most of the time, they don't get good protein when they don't get good nutrition overall. So what's interesting, too, is we don't see these disorders in the developed world, but we see malnutrition. We see a lot of malnutrition, actually. The studies tell us it can be very common. Some studies say up to 25% of kids with chronic diseases have malnutrition in the U.S. Now, the thing is, they have some underlying disease. They have an etiology. There's a mechanism going on that causes them to be malnourished. There's all these dynamic interactions that impact their intake or their use of nutrients, and it has an impact in the long run on outcomes. So there's this new modern definition of malnutrition that was published in 2013, and it recognizes that there's a link between malnutrition and diseases and inflammation that comes with diseases that leads to malnutrition, and it's disease-related malnutrition. It recommends using Z-scores, which is the standard deviation score from the mean for weights and heights and BMI and all that. And that's the markers for malnutrition. And basically, how many Z-scores are you from the mean? And it's basically, that's the modern definition for the developed world. This modern definition approach is endorsed by the American Society for Endocrine Nutrition, the Academy of Nutrition and Dietetics, which is the Association for Dietitians, and the Academy of Pediatrics. So this is what we're moving to in the U.S. And you diagnose it, literally, you put the diagnosis in it, and you say, this is malnutrition in a child with congenital heart disease. You recognize they have congenital heart disease, which may make their nutrition a little better, but it's not okay because the studies now tell us that the outcomes will be better if the nutrition is better. So, in the old days, I can remember when we would say, well, they're malnourished, but they have congenital heart disease. Well, now that's not acceptable. We need to intervene and improve their nutrition. I'm getting a little evangelistic on you. Sorry, guys, but I'm a nutrition person. But if you see malnutrition, having a disease is not an excuse anymore.